Ya Ali Madad. My name is Dr. Sherin Kasamali. I'm an emergency physician and the member of the Aga Khan Health Board, Tanzania. Over the last few weeks, ever since the first case of COVID-19 was reported in Tanzania, our world changed. We had to learn about and cope with the COVID-19 pandemic. The last such pandemic was declared nearly 100 years ago. Our daily practice and routine changed. Jamaat khanas closed. Schools and universities closed. International flights were stopped, and all of these were efforts to reduce large gatherings, to reduce transmissions, and to flatten the curve. The curve refers to the number of people infected over time. When a lot of people get infected over a short duration of time, the curve rises steeply. This steep increase may overwhelm the healthcare capacity. Flattening the curve means to stop the mode of transmission, to reduce the surge, reduce the number of infections so that the sick can receive appropriate and adequate care and not to overwhelm the healthcare capacity. Recently, you may have heard that the number of patients in hospitals is reducing around Dar es Salaam. This is true and good news for us and the country. Unfortunately, this does not mean we can relax now. We still need to take maximum precautions. Remember, symptoms for COVID-19 has a wide presentation, from mild symptoms to severe form of disease. From studies done, it has shown that around 80% of patients with COVID-19 have mild or moderate symptoms. This means they do not require oxygenation and may not require admission in a hospital setting. In some countries where mass testing have been done, up to 18% of patients with COVID-19 were asymptomatic. So not all patients with COVID-19 are in hospitals. We also need to know and remember that currently there is still no proven treatment for COVID-19 and there is no vaccine yet for COVID-19. At some point, schools, universities, and life will need to return to normal. What does the Jamaat need to do then? We need to use our knowledge we know about the disease so far to protect ourselves, our loved ones, and everyone else. Remember to maintain good hygiene. Wash your hands regularly or use hand sanitizer. Avoid touching your face with unwashed hands and wear a mask whenever you're around people. Avoid large gatherings and maintain physical distancing at least 1 meter apart. And follow the guidance given by the Aga Khan Health Board and the local government. I would also like to remind the Jamaat that there is a lot of misinformation about COVID-19 circulating on social media. This misinformation can be detrimental and harmful for the Jamaat. Whenever you receive such a message, pause, verify the information before sending it out. If you're unsure, don't send it. As the science changes and evolves, continue to educate yourself from reliable sources. Also, nurture your physical, mental, and spiritual well-being by connecting with family and friends virtually rather than physically, by exercising and eating healthy, and continue our prayers regularly. Together, we can beat this pandemic. Be the change, stop the transmission. It begins with you. I'll end by a quote from Warren Buffett. It is not necessary to do extraordinary things to get extraordinary results. Be safe and Ya Ali Madad.